Good afternoon. Good afternoon, everybody who has joined. I am seeing that there are 28 people and we are still joining in. So I'm going to give Lorato, if it's okay, 2 more minutes for people to join in so that when we start, most of us are in. All right. Yes. Thank you for joining in. As you come in, we are just waiting for some of our colleagues to join in. We'll start in a minute. Good afternoon, colleagues. Good evening. I don't know whether it's evening where you are. Good morning if it's morning your side. And let me just say welcome to ISSUP Botswana's second webinar this year. And let me also take this opportunity to just thank all of you who are joined in, who are still joining in, to have created time to actually have a dialogue or to listen to our presenter, who I'm going to shortly introduce, to talk about the clinical supervision, most importantly, highlighting its importance within the drug demand reduction field. Before we go any further, I want to ensure that I do actually put out a disclaimer to just please note that this information it's for informational purposes only. It does not constitute to medical or treatment advice, and the views that are presented by the speaker and do not necessarily reflect the views of ISSUP. So that is the disclaimer that I wanted to make. So I hope that you are all joined in, tuned in to this very exciting presentation by our presenter. And speaking is Dr. Selemope Matsetse Morekwe. For those that know my first name, I know Lorato will tell you is Morekwe. I am currently the ISSUP chapter, ISSUP Botswana chapter chairperson, and with me are my colleagues from the chapter, and thank you for those that are joining outside Botswana, and we really appreciate your support in that. I will take this moment to actually introduce our esteemed guest and speaker, Ms. Lorato, and I am going to give you a brief bio about Ms. Lorato, who I have worked with in some areas in the drug demand reduction. She is a level 3. Her full name is Lorato Koosaletse. Is a level 3 internationally accredited addiction professional who's currently employed with Botswana Substance Abuse Support Network, commonly known as BOSASNet here in our country. It is the first rehab center in Botswana, and she works there as a clinical manager. Lorato has a master's in social health degree from University in Sydney in Australia. I must say that she is also a global trainer in different forums of drug demand reduction. She is a UCT, Universal Treatment Curricular trainer. She is also a women intervention for substance exposure-wise trainer for drug advisory program under Colombo. Lorato has a extended experience in substance use disorder treatment as a counselor, number 1, as a trainer, and as a supervisor. She is passionate about youth and women, as we can see. As she feels they have unique challenges related to substance use and addiction, she is dedicated to providing quality and evidence-based care for people with substance use disorders and their families. I know there's a lot that I can say about Lorato, but this is the shot that I will share with her. And so, Lorato, the floor is yours. We are excited to hear what you have to share with us in terms of clinical supervision. Thank you. take it from here.
Thank you very much, Dr. Selemo, for that lovely introduction. Good morning, good afternoon, good evening, everyone. Thank you so much for giving us your time today, and I hope it will be a very exciting 40 minutes or so, and well spent. So I'm just going to jump right in and talk about clinical supervision, because this is a topic that is near and dear to my heart as well, because you cannot talk about evidence-based practice and not talk about supervision as well. And we're just going to look at a couple of definitions of what clinical supervision in fact is. It is the provision, according to Kilminster et al. In 2009, they did some study and came to a conclusion that clinical supervision is the provision of guidance and feedback on matters of personal, professional, and educational development in the context of a trainee's experience of providing safe and appropriate patient care. I think the key things to note here is that supervision includes giving feedback on personal challenges, professional, and educational, all of these for the development of the counselor, right? Because what we want is a fully developed counselor who is able to provide safe and appropriate care for clients who are seeking help from them, right? And the next definition that we will look at is by Logan, Bill, Hardy, and Delworth, which says that supervision is an intensive, interpersonally focused, one-to-one relationship in which one person, the supervisor, is designated to facilitate the development of competence in the other person, the supervisee, right? So in this definition, we are looking at the roles, we are looking more at the roles where the supervisor, right, is focused on the one-to-one relationship, and their real main focus is to foster development or to develop the skills of the person that they have been put in charge of, which is the supervisee. So before we continue, I would like for us to just for me to have an idea of who is in the webinar with us. I would like for us to do a little poll where we will look at we'll answer just a couple of questions that will give me an idea of who the audience is. Olivia, please help with the poll. All right. And as you are filling out that poll, I will continue with the presentation. Supervision has 4 key areas or variables that we will be looking at today. There's the supervisor, the person doing the supervising, the supervisee, the recipient of the supervision, the client, who at the core of it is really the focus of supervision, vicariously through the supervisor and the supervisee. And we also look at the setting in which supervision occurs. How is the supervision provided, and who's providing it, and who is present during the provision of supervision, right? So that's what we're looking at when we're looking at the setting. So the purpose of supervision is to facilitate supervisee personal and professional growth, right? That is one of the key factors for supervision, for providing supervision, and is to promote counselor competencies, knowledge, and skills, as well as to promote accountable counseling programs. So any drug demand reduction program that provides treatment services requires that there be supervision, that it be an integral part of the program, just so that we are sure that even as we follow theories, as we follow guidelines and manuals that have been created, that we are actually maintaining fidelity to those manuals and to that education that we have received, or that training that we have received as counselors. So supervision is one of the things that, one of the ways that we are able to maintain that fidelity, or ensure that we are, in fact, following what is meant to be done, right? So the supervisor has wears a couple of hats, if you will. They are a teacher, right? Where it is just sometimes supervision involves that it's just teaching. Today we're gonna be learning about motivational interviewing, and you're gonna teach your supervisee what it is, how to do it, and give examples based on the counselor's experience or your experience as a supervisor. So I'll be talking through the presentation. I'll be talking as sort of somebody who, as a supervisor, more from the position of a supervisor. But as a supervisor, I am also a supervisee. I also receive supervision. So to make sure that even as I supervise, I am maintaining fidelity to manuals and theories, as I just mentioned, right? The supervisor is also a coach to encourage the supervisee or the counselor as they're doing their work. As you know, coaches provide the technical skills. They also just are a motivator, right, for the person that they are, or for their client. The supervisor is also a consultant, where the counselor can come at any point and seek additional information, look for different ways of looking at a situation and exploring how to effectively help a client, because every client is different. Even if they are presenting the same challenge or they have the same challenge, everybody will experience their challenges differently. So there is no one way of dealing with everyone, right? So from time to time, you might run into challenges where you need to consult with someone else to just get a different perspective. And then the supervisor is also a mentor to the counselor. And as can be expected, like with all the other roles, really the supervisor is there to support the supervisee or the counselor as they journey on and become and develop those skills and improve the skills of being a supervisee or being a counselor, right? We want to look at a few principles that are central to providing clinical supervision, right? Like I've already said, clinical supervision is an essential part of all clinical programs, and this is really worth repeating, right? Clinical supervision is essential. It has to be done for us to be able to maintain the level of care that is required in the field of drug demand reduction. This is because this is a very challenging field. If you look at it, we're looking at helping people who in their lives have been turned upside down, that substances have come in and they have brought chaos, confusion, there have been a lot of losses associated. And so we are dealing with, or we are helping people who sometimes may be feeling very lost themselves. So it is important that that we ensure that the counselors, the people providing the service, are taken care of, right? Supervision also helps to maintain staff and improve their morale, because if you've ever been in a service or sought service from a facility that does not provide supervision, you can just tell the staff is not really motivated to engage with you. It would appear nobody really cares to help you. And it's not because people intrinsically don't care. It might just be that they're on the verge of burnout, right? And their morale is that low. Every clinician, regardless of level of skill and experience, needs and has a right to clinical supervision, right? You can never know enough that you never need supervision. It is just our lives are evolving, the training that we have received. Some of us might have received our training some years ago. I won't give numbers, but you know, we need supervision, as we've already seen with the roles, that there's an element of teaching there, there's an element of consultation, is where you get the opportunity to learn about the latest developments in your area or in your field. So, and in addition, supervisors need and have a right to supervision of their supervision, right? So even as I receive supervision as a supervisor, I also receive supervision around what I do as a supervisor, so that my supervisor ensures that the skills that I have, where supervision is concerned, are improving, or are at least maintained, and that they keep getting sharpened, so that I can provide the best possible supervision for my supervisees. Clinical supervision also needs the full support of the agency administrators, and in my case, that will be BOSASNet, which fortunately I do have. I have the support of my board and senior administration, right? So that means that when issues come up, where if, for instance, there's a traumatic experience, right, then the board or the senior administration understands the need of what supervision is. They will understand debriefing, the process of debriefing, and afford the staff the opportunity to receive that support that they need. The supervisory relationship is also the crucible in which ethical practice is developed and reinforced. In a field like the one we are in drug demand reduction, it can be, ethics are challenged all the time, because we are dealing with clients who, unfortunately, by virtue of substance use, also learn to become manipulative. I'm not saying every client is manipulative. I'm saying that part of the disease and the disorder is that you might come across people who have learned the skill of being manipulative. And sometimes that manipulation can also lead to things like bribery and things like that. And if ethics are not fully in place, it is very easy to fall down that slippery slope. Clinical supervision is a skill in and of itself that has to be developed. So just because you have been put in the role of being a clinical supervisor doesn't automatically mean that you will do an excellent job. You actually need to go and get training for yourself and upskill, so that you are able to do the work effectively in an evidence-based manner, right? So the last couple of points we're going to look at is that clinical supervision in addiction treatment most often requires balancing administrative and clinical supervision tasks. This, to be honest, was for me one of the most challenging things, because I was a counselor before I was a supervisor, right? And as a counselor, my experience of supervision was, a lot of it was, yes, how to do the administrative work, but also a lot of it had to do with working on myself, right, as a person, as a professional, as a person, and how I relate to other people. So then ascending to the role of supervisor then meant that, and I was supervising people who prior to that were counselors with me. And so to then come in and be the administrator and do the administrative supervision part was a bit of a challenge, because also you then, sometimes it can be very easy to fall into over correcting, if you will. So, you know, and that's why supervision works, because then I would talk to my supervisor through that and learn how to balance the administrative and clinical tasks, so that counselors would receive both. Culture and other contextual variables influence the supervision process. In a lot of our experiences, especially for Botswana, I would say, is that there is this certain understanding, probably more of a misunderstanding, that culture is the same, or because most of the people are the same, then that You know, we are Botswana, so we have similar, and we do have similar practices, but there are nuances. And it is the responsibility of the counselor to actually learn what those nuances are and what those differences mean to each client. And again, everybody is different. So supervision is one of the ways that we're able to help the counselor work through that for themselves so that they're able to provide better care to their clients. So supervisors need to continually strive for cultural competence themselves before they're able to teach or mentor their supervisees in that, right? And so in wrapping up the central principles of clinical supervision, we look at that successful implementation of evidence-based practices requires ongoing supervision, right? It has to be ongoing. It's not a once-off. It's not a, you've gone for training, now you know what supervision is, you go ahead and do it. Go ahead and practice. It's an ongoing process, and supervisors have the responsibility to be gatekeepers for the profession. This is so crucial because in areas where there isn't any gatekeeping, people are liable to do whatever they want to do. Anybody can set up a center and say they're providing rehabilitation services and in fact be doing more harm to clients who, again, are very vulnerable due to the nature of the disorder that they have. Clinical supervision should involve direct observation methods, right? So as a supervisor, it's good to trust your supervisee and to be able to do the debriefing in one-on-one situations where a counselor lets you in or tells you what has been happening in sessions, but it's also very important that you get to observe those sessions, right? And see how things actually pan out, all right? Olivia, may I please have a look at the poll results? Right. May we have a look at the poll results, please? Okay. All right, so we're gonna look at, I think, while we wait for the poll to show up, we're gonna continue, and I'll just stop whenever it is ready. So we're gonna look at the administrative part of.
Sorry to interrupt. I think the poll is showing. It's you might need to just exit your presentation for a second. Just exit
Okay.
to see it.
Okay. All right. And then go back there. All right.
So hopefully in GoToWebinar you should see it.
Okay.
Are you seeing it? Because it has, what we are seeing on our end is that, have you received clinical supervision before? And answers 56% have and 44% have not. They said no.
Okay. Oh, all right. I'm not seeing it at all. Okay. There we go.
And then
Okay.
weekly is 21, 11, 32, and then 37. So I don't know whether are you seeing it now, because there is an answer that yeah, okay.
Yeah, I'm seeing it now. Thank you, Marakwe. Yeah, that's very interesting. That, yeah. All right, and all right. So the majority of us have received supervision and are receiving it on a quarterly basis. The vast majority is receiving supervision on a quarterly basis, right? Which for me it's not too bad. It's better than not receiving supervision at all. But I would recommend that it be more frequent than that. I understand that sometimes, especially in this field, particularly drug demand reduction, that we may not have as many supervisors as we do in other fields. And it's one of the things that we will talk to as we continue looking at the presentation and the discussions going forward. I like what I am seeing, and it is a good spot for us. I think it's great to know this, to have this information, because it does give us a start in terms of what we're going to do about supervision. You see, one of the reasons we are doing this webinar, especially on clinical supervision, is in recognition of the fact that it is a gap in service provision in the drug demand area, particularly in Africa, I think, especially in Botswana, right? So when we look at, thank you for that, Olivia, and thank you participants for filling out the poll. It has given us some great information. Right. So administrative supervisors oversee the therapist's work on behalf of an organization, right? And that organization.
Sorry, we can't see your screen at the moment. You may just need to click share on the notification again.
Okay. All right. There we go. Better?
Not yet.
Yes,
Okay.
there we go. Thank you.
All right. Thank you, Olivia. Okay. Yes. All right. So again, at the core of supervision is the real reason why we do supervision is to provide better quality care for the client, right? So clinical supervisors also provide evaluation primarily for the purpose of the supervisee's professional and or personal development, right? If you have a role as a supervisor and your supervisee is not growing, there is need for a conversation to explore what the challenges might be there. And even as a supervisee, if you are receiving supervision and you feel like you're not growing beyond as quickly as you would like to, it's a conversation also worth having, because it's important that both the supervisor and the supervisee feel like it's an effective relationship that will, in the end, help clients, right? Administrative supervisors are concerned with role, duty, and function, right? So when, you know, I love that I'm talking about it as clinical administration, separating clinical administration from the rest of the supervision processes, that, you know, in other countries, they actually are specialists in those sorts of areas. So it is one of the things that I want us to talk about and know about, so that we can advocate for in our own countries where we are working, or start at least in our own organizations, right? So the roles and responsibilities of supervisor and the supervisee, right, are that the effective is when we look at one of the things when we look at setting, supervision can be provided either one-on-one and in group settings, or both, right, where the counselor has an opportunity for one-on-one sessions, but as well as for group supervision. And as with group counseling, generally, as the benefits of group counseling will also spill over to the benefits of group supervision. But how well that happens depends on the facilitation skills of the supervisor or the person leading the group, as well as the openness of the supervisees to share and reflect, which again most of the time leads to trust in the process, and if the supervisor has effectively managed to create a safe space for the counselors where they can openly share. And the role of the facilitator is to guide the group towards openly sharing ideas, opinions, expertise, and experience with a view to achieving an agreed set of goals, right? So again, as much as each client is different, each counselor is different, and every client the counselor will experience differently, and they will use different tools to engage the client in therapy, to motivate the client to change. So you'll find that sometimes counselors are stuck with a client, and it's not because the counselor is incompetent. It's just that perhaps they have not they have run out of ideas of how to help this person. So in a group counseling supervision, in a group supervision session, it's an opportunity for other counselors to actually then give ideas of how they have managed, or activities that they have used or adapted that might help that person get unstuck, right? So supervision, just like with counseling and everything else that we do in helping the client, has to be planned in advance. The supervisor has to take a neutral position and focus purely on the group process and desired outcomes, have to listen actively and ask questions that encourage and direct participation relevant to the goals of the group, and draw out quieter members of the group and allow everyone a chance to participate, right? Because again, every voice is important, everyone's experience matters and contributes to the whole of what the organization is doing. They are not afraid of silence and recognize when the group needs space to think. There's always a need, just like with any interaction with clients, we need to check for understanding, that the counselor and the supervisor, or the supervisee and the supervisor, are on the same page, and keep the group focused on the agenda. What is the purpose of supervision, and what are we doing today, right? And the supervisees should be prepared to listen actively and share openly, should avoid taking the conversation off in directions that are not useful. That's not always easy to pick that this is not useful, but as the conversation evolves, it's important that then it can be redirected and stay on track. They should be able to show respect towards others and avoid dominating the discussion. Just as with group counseling, it doesn't always help when there are two dominant forces within the group supervision setting, right? Again, like I said, everybody's voice matters. And so it's important that even if there is a dominant personality, that they be allowed to share effectively, but also give space for others to share. And the supervisor should be mindful of their duties regarding confidentiality. I think supervision is a great way of reinforcing the ethics, and like when we do our supervision, we don't discuss clients by names. It's just using client numbers and just very general broad stroke descriptions that will not make it easy to pick up on who the counselor is talking about, right? And I've been giving examples of what happens in group counseling, right? As well as one-on-one counseling, I suppose. But here we're going to look at what actually is the difference. Is there a difference between counseling and supervision, right? And we will look at the purpose first of all. So for clinical supervision, it is for improved client care and improved job performance. That's what the purpose is, right? Administrative supervision is set up to ensure compliance to manuals, to guidelines, to the agency's mission, vision, and other guidelines and policies. And then in counseling, the purpose is for personal growth of the recipient and behavior change and better self-understanding of the person receiving the counseling or of the client, right? So that's where the difference is. So the purpose in clinical supervision is, again, all roads there lead to improved client care and improved job performance by the counselor, and administrative supervision ensures compliance. The outcome is enhanced proficiency in knowledge, skills, and attitudes essential to effective job performance for clinical supervision, and consistent use of approved formats, policies, and procedures for administrative supervision. And in counseling, it's open-ended based on what the client needs and what the client wants to achieve when they are seeking help. The time frame is short-term and ongoing for both clinical and administrative supervision. Short-term usually happens when we are dealing with crisis intervention situations, and then it should be ongoing as pertains to general personal and professional development of the counselor. And then the time frame for counseling is based on the client needs. The in clinical supervision, clinical is set by the agency, right? It's set by the agency needs, and administrative supervision is based just on the agency needs, doesn't really take into consideration the counselor needs. And in counseling, it's just based on client needs, right? Doesn't really take into consideration what the counselor needs either. So the basic process of delivering these three areas, or particularly clinical and administrative supervision, is that in clinical supervision, we are teaching or learning specific skills and evaluating job performance, negotiating learning objectives, right? And in the administrative supervision, the role or the basic process is to clarify agency expectations so that the counselor operates knowing what the policies and procedures of the agency are, and that the administrative supervisor will ensure compliance thereto. And the basic process for counseling is that behavioral, cognitive, and affective processes, including listening, exploring, teaching. So here the counselor is just gonna be facilitating the behavioral and cognitive changes that are needed for the client to progress, right? So in looking to wrap up, we're gonna look at the challenges that supervision, that we face in supervision. First, from the supervisee's perspective, and one of the biggest challenges that I have found is that as both a supervisee and a supervisor is that sometimes the supervisee doesn't always understand what supervision is, what the purpose of supervision is, and therefore may not necessarily fully engage in supervision, right? Another challenge is in trusting your supervisor. Just as with counseling, it takes time. It can take time to build up that relationship to the point where the supervisee is actually open and able to share the real challenges that they're facing in the counseling room, that will facilitate their own personal and professional growth. And another challenge is just trust in the process of what supervision is, and trust in that what is shared in supervision will not necessarily overflow into and become punitive when it is taken out of the supervision contract or relationship in terms of delivering on the job, right? And then from the supervisor's perspective, some of the challenges are feeling competent. Do you feel like you have the skills? Do you feel like you are able to actually deliver on what is supposed to happen in supervision? Do you understand all the ethics? Do you understand the policies? Do you understand the procedures, all of them fully enough to be able to provide the supervision? Are you able to understand supervisees and give them the time that they need, just as a counselor would question if they have those skills with their enough skills to service or support their client, right? And another challenging, one of the challenges that I have personally faced is differentiating between supervision and counseling in terms of, it's not just that you can't differentiate what supervision is and what counseling is, because it's there, we just looked at what the differences are, right? But in reality, in actual practice, especially when you know, in the context of Botswana, for instance, Botswana is a very small country. I know it's a small world, theoretically speaking, but Botswana is a really, really small country, right? And the drug demand reduction field is even smaller. So you know that, you know, we know each other, people know each other, and it's very difficult, even as a counselor is going through a personal challenge. Sometimes it's very difficult for them to access services outside of the agency, if you will, and therefore sometimes depend on the supervisor to get some of that counseling. And so it can become very challenging for the supervisor to actually be able to differentiate that and guide accordingly, and make sure that supervision and counseling remain separate. It's not always possible, if truth be told, but you know, it's one of the things that, again, the reason why even supervisors need supervision, to make sure that fidelity is maintained and that the best appropriate care is given to the supervisee. All right. And as we wrap up, we realize that just general challenges that very few organizations or centers provide clinical supervision to staff in Botswana, and that staff expect supervision to be provided for free and do not necessarily see it as a contribution to their own professional growth. This is, I think I speak for Botswana because this is a conversation I've had with people from different areas in the drug demand reduction field, people who are civil servants, people who are in the private practice, people who are in the non-governmental organization space. And because of the different structures in funding, the expectations are different. Where generally in Botswana, if you are a civil servant, generally your employer being the government really pretty much funds everything that you are doing. And so even as supervision is not available or may not be available to you as a resource, it's very difficult for some people to understand that they actually then can seek supervision externally and pay for it themselves. And it's one of the things that also for supervisors is a challenge, because if we're being real, this work requires that, you know, if you're going to be a supervisor, it's a lot of time and energy on your part. So, you know, people need to be compensated accordingly. So that can be one of the barriers to actually receiving supervision, can be the cost. The cost can be prohibitive. The availability of supervisors, again, and that leads me to my to look at what we have managed, though, in spite of all these challenges, is that, you know, the counselors do have increased skills. They have a faster response to crisis situations because they trust themselves more, they trust the process more, and they trust the agency more. There's an improvement in networking in terms of that supervisors and supervisees get to interact with each other and with other people from other organizations, and especially when it comes to peer supervision. You know, we encourage peer supervision simply because we do recognize that there are a limited number of supervisors available in the country. Then there's increased confidence of both supervisors and supervisees when the work is done and done well, right? And that can only work to the betterment of the care that is received by clients. In closing, I would say that as a country, we have not yet received clinical supervision training from the DAP, which is something that we really need. And I'm here lobbying for that. And I hope the right ears are tuned in to listen. But we need to provide training for clinical supervision because, again, unfortunately, a lot of the organizations think of supervision more in an administrative manner and less in a clinical manner, where counselors actually, or service providers, mental health providers need to debrief and need to be trained and need to be mentored to develop their skills, to develop personally as well as professionally, right? And so with that, we need to lobby for clinical supervision to be mandatory for mental health counseling providers so that we can be sure that the care that is given to clients is the right care, it is appropriate, it is evidence-based, and that the fidelity is maintained to the training as well as to the ethical principles that we follow as addiction professionals. And for that, I will hand over to Dr. Selemoge to get us through the questions, if there are any questions that we have received. And thank you very much. Ke a leboga. Danke. Thank you for your time.
Yes. Thank you, Lorato, for such an informative presentation. I had written on the chat that if you have any questions, please, you can go ahead, put them on the chat. But since we are here, we have 10 minutes, and thank you for giving us enough time just so that if there are questions, comments, and feedback, we can actually do that. I'm not seeing any questions for now, but you are free to raise your hand so that you can actually be pointed to ask any questions. And I will be waiting for you as you do that, just to give a summary in terms of what Lorato did teach us. The one thing that I actually got was the purpose of clinical supervision is for personal and, most importantly, professional growth. I think a lot of times we don't see the personal growth being a bit separate from professional growth. And so it was a bit concerning for me that we don't have regular supervision, which a lot of people, I know in developed countries, it's a weekly thing, but I'm seeing a lot of us have it on a quarterly basis. So I'm hoping that as we go into our different institutions, we really think about this importance so that we can continue growing as professionals and also ensuring that the quality of care that is given to our patients and clients is at its best, because that is at the core of clinical supervision. We are doing it so that we improve ourselves and sharpen our skills as counselors, as clinicians, to ensure that there is a difference that we make in the lives of those that are trying to have sobriety and in recovery. And then you did speak about the different roles of the supervisor as being a teacher, a coach, a mentor, and a consultant. Yes, I think I remember the fourth one. Yes, that there's clear indication in terms of the clinical supervisor's role. I think one of the things that I got from your presentation, I'm just waiting for the question, is this dual role that sometimes people have in terms of being a clinical administrator and then being a clinical supervisor, and then having a therapist, because there's that other dimension of having a clinical therapy as a counselor, which is not necessarily clinical supervision. I know in some instances I've seen that. Yes, we do have a question, so that the question says, how can I sharpen my supervisory skill? That is a question.
Yes. Well, training really helps. But one of the things that I've had to do as I patiently wait for myself to receive this training that I'm talking about is look at resources like the SAMHSA. It has a lot of resources. It has one of the tips, I think it's tip 57, treatment in improvement protocol. I think it's tip 57 that talks specifically to clinical supervision and the skills that are needed by a supervisor. So it, and also seek clinical supervision. That is also one very good way of sharpening your clinical skills. And also to talk to what you were talking to Morako before we answered the question was that, yes, I keep dreaming and hoping and salivating at the prospect of one day that in Botswana we will actually have such a huge number of clinical supervisors that this will not be even an issue for us. But yes, it is a bit of a challenge when you are providing, like in my role, I provide both clinical and administrative supervision. And sometimes you plan a supervision session with the supervisee, and it is, you've planned that it's going to be administrative, right? But it is very difficult for it to be purely administrative. You will not purely be looking at policies and processes of an organization or looking at just what has been written, because what has been written and what is presenting in the client's file probably more often than not leads to then you coaching. A lot of the time I just find myself doing both concurrently. So it's very difficult to even separate those two, let alone separate it from the counseling aspect as well, or the clinical therapist view as well. Yeah, it can be a bit of a challenge.
Yeah. So what I'm hearing is training. Training can actually help us in terms of sharpening our skills. I think we can also be more proactive in terms of seeking supervision as supervisors. And I'm just waiting for any other question, clarification. How do you handle a supervisee who begins to present personal therapy issues in supervision? That is the question. How do you handle a supervisee who begins to show issues that need therapy?
Yeah. It's in pretty much the same way that you would handle a client who is showing challenges that are beyond your scope, right? So as a supervisor, you acknowledge the challenges that the supervisee is facing, and sometimes the supervisee themselves doesn't actually realize that these are challenges that go beyond just that I'm not happy with this client or I'm not happy with responding. They are deeper challenges, and they are leading and tapping into unresolved issues for the counselor. So then once that has been acknowledged and put on the table, then you make the recommendation that the counselor does seek therapy.
Okay, thank you for that.
It helps. Yeah, and it helps if you have the support of the agency. Like at BOSASNet, we have that support where if a counselor needs therapy, they can be given time to actually go for therapy even during their working hours. So it helps if there's also that support to make sure that you know, we are keeping with the guidelines.
Yes, no, thank you. I think it does speaks to ethics in terms of ethical boundaries in how we would want to draw boundaries in terms of how we relate with colleagues. But I also have the understanding, and I'm very cognizant of the fact that we are resource limited, and so sometimes it can pose a challenge. But where there is an opportunity to refer, that is what Ms. Lorato is saying. Another question here is, and just be brief because I have two questions here. Can a counselor also be a clinical supervisor at the same time? No, and the first one was, other than peer supervision, does the manager boss has to be an automatic supervisor? Just be brief, kindly, looking at our time in answering.
Yes.
We'll start with that one. Other than peer supervision, does a manager boss has to be the automatic supervisor?
That's how it works in practice, but no, it shouldn't be that way. A supervisor should be somebody who has skills and who has more skill than the supervisee in the area that they are providing the supervision is. That's the short answer of it.
Okay, thank you. I know I said it should be short, but I think what is highlighted here, yes, what is highlighted is that clinical supervision actually requires clinical supervision training because there are theoretical frameworks that people use. I know that we didn't have time. Maybe it's a good point in that we should have a second seminar in that. And then the next question is, can a counselor also be a clinical supervisor at the same time?
Who would they be supervising? Who would the counselor be supervising?
Yeah, I think the question though,
that.
I see it when a clinical supervisor also has clients. I don't know whether the person was saying that or
in that regard. Oh, okay.
Yeah. Yes.
Yeah.
Okay. And then the other question, I know our time is up, colleagues. The other question is, are supervisors expected to keep records for supervision notes?
Yes.
Yes, she says yes. There is need for documentation. Remember, even like in terms of treatment, we always talk about documentation. If it's not documented, it was not done. I think it's also a reference point for monitoring and evaluation. That's why documentation is quite important. And then we do have a question here which says, there are instances where supervisors are better equipped and having a lot of experiences in their work. In this case, what kind of support can we provide to such supervisee instead of having a session just for the sake of it? I think maybe also to just highlight there, Lorato, is that, you know, like for clinical supervision, we do have instances where, and a lot of times, where people come in having prepared a case to talk about case conceptualization, how they understand the presenting problem from a theoretical point of view, and then they provide the treatment plan and how they are implementing the treatment plan. And then if it's in a group, people then give feedback in terms of that. And so for supervisees that are more equipped, actually it's a good thing to have them in an agency so that they can actually share their skills and their experiences in terms of dealing with a different clientele that we normally find ourselves with. So yes, sometimes we get clinical supervisors who are fortunate, in my opinion, to have supervisors who are well vested. So you can actually utilize those skills so that you don't just think about yourself in that role. The last thing that I thought we could conclude with, Lorato, was the issue, what the expectation that I know you did touch on it, that, you know, during clinical supervision, there has to be sort of a contract, and it depends on the agency, as Lorato has said, where we understand each other's roles, expectation, there's clear scheduling, there's a clear understanding of what should be presented in the clinical supervision, and then the progress that is supposed to ensue out of that. And so the question that was asked about supervision notes is actually relevant in that regard. So So we are running out of our time, but I'm not seeing any questions. So let me just see whether I skipped any questions so that must one have clinical background to become a clinical supervisor? Lorato, you can simply answer that. Must one have clinical background?
Yes. So when especially we're talking about clinical supervision, we're talking about providing the teaching and the coaching and all of that, those aspects of what the role of a supervisor is, and those require somebody who actually has the skills to impart to the supervisee. So yes, training. And so I know, because somebody's thinking, oh well, then if you've just gotten the training, can you do clinical supervision? Typically, you need to have some years of experience under your belt before you can become a clinical supervisor. Not to say it's impossible, but it is preferable, and it works better when that is the case.
Thank you, and thank you so much. Let's clap for our presenter. Let's show there's a button where you can actually clap hands for the presenter. Let me just take this opportunity to thank once again Ms. Koosaletse Lorato, who is one of the members for ISSUP Botswana, I must say, for sharing her her experience and imparting on the knowledge. I think as ISSUP Botswana and as ISSUP Africa, we are happy that you've been able to join us in this discussion. I'm hoping that we further the dialogue because of the stats that we got today. The yes is 56% is okay, but the no is 46%. I think what maybe is concerning is the frequency in which we are actually seeing ourselves actually receive this very important important aspect in terms of our growth as professionals. So thank you, and I hope it has been fruitful for all of you, as it has maybe probably for me as I was listening. We can show our faces. Olivia, if we can take a picture so that we can release colleagues, and so thank you and thank you. We can take a picture. So we can show our webcam. Where there's webcam, you just click on that. We should be able to see you.
I'm really sorry. I'm afraid it's not possible for the attendees to show the webcam on here, but I can take a picture.
Okay. Okay, okay, yeah, maybe a picture of me and Lorato. But thank you, colleagues. We hope to see you in the next ISSUP webinar for whichever country that will be presenting. And so thank you. And let's continue doing the work in terms of the drug demand reduction. Let me also take this opportunity to thank Rudolph and Olivia, who've been very supportive in preparing for this seminar. So thank you, colleagues, and thank you, ISSUP, for the support as always. Thank you, and good night, good afternoon. I don't know whether there's good morning, because I saw that we have people from different regions of the world. So thank you, and bye.
All right. Bye, everyone. Thank you for tuning in.
Yes, bye-bye.